for a reason. Because if he's like that, gravity's going to be pulling his leg down and kind of open up the joint. Now, to be honest, it's actually best if you have a real skinny guy, because anybody like a lineman or something like that, it's going to be a little more difficult. But, you know, Charles is okay. So what structures we got, right?
Medial tibial plateau.
Medial tibial plateau. So the easiest thing to do right off the bat is find the joint line. So what I like to do is have them bend a little bit. So flex your knee up and down, flex and extend. Find the joint line. So here are my condyles. Here are my lower condyles. So here's the knee joint. So now you visualize the tibia right here. Femoral condyles up high. Tibial condyles are the lower portion of the joint. Now the key to the condyles of the tibia is as we're palpating, if you go up a little bit, you're also palpating the lateral and medial tibial plateau. And on top of there is the meniscus. So you're kind of doing a 3-for-1 deal. You got the lateral condyle, the medial condyle, the plateau if you go in and down, and at the same time, you're pushing on the meniscus. Next one, right.
Tibial tubercle.
Tibial tubercle. So that's the point at which the patellar tendon comes down. Now we have two parts to the patellar tendon. It really is one big strap, but we have the suprapatellar tendon, which is above the patella. We have the infra, which is inferior to the patella, but it's all one part. And it attaches to the tibial tubercle or tibial tuberosity.
Medial femoral condyle.
Medial femoral condyle. We got the femur up high. Find the knee joint again, have them go up and down. Perfect. We know the medial's on the inside, it's the big rounded off part. Lateral's on the outside, it's the big rounded off part.
Adductor tubercle.
Adductor tubercle. It's actually down here. I'm usually not going to test you on it. Next.
Lateral aspect, the lateral tibial plateau.
Lateral tibial plateau, we already touched. Joint line right here.
Lateral tubercle.
Lateral tubercle, we're not going to worry about today.
Lateral femoral condyle.
Lateral femoral condyle, we palpated right there.
Lateral epicondyle.
Lateral epi, we've got the medial also. Find the condyles of the femur. Go to where they end and go right above them behind the knee. You're going to feel this bump. It's not comfortable. This is one of those uncomfortable palpations. You'll feel a bump right above the condyles, and that's where they are. We got the lateral, we got the medial.
The head of the fibula.
Head of the fibula. Extend the knee. Look for the LCL. Follow it down. You're going to feel the big bump at the base of it. That's the head of the femoral, or the fibula, excuse me.
Anterior aspect, the patellar groove.
All right. Patellar groove or notch can only really truly be palpated in one position. Seated. Find the kneecap, go behind it, and you're going to feel a little hill and valley. Hill and valley. That's the patellar groove, patellar notch. So let's stop right there.